I would like to welcome now my first guest into the studio. This is Dr. Sue Storti, a noted healthcare administrator and researcher of treatments for addictive disorders. Thank you for coming.
Thank you for having me.
And we welcome Sue because she is the new president and chief executive officer of the Substance Use and Mental Health Leadership Council in Rhode Island. Tell folks a little bit about the council.
Well, the council is comprised of 28 organizations that represent everything from prevention and mental health to substance use disorder treatment providers, recovery houses, really across the spectrum.
And the work, when you all come together, advocacy, action, tell us what it is that you're looking to achieve by grouping together on the council.
Well, our primary role really is to inform the community as well as take an active role at the state level and local level in terms of making sure that the quality of services that are being provided, whether it's prevention, intervention, treatment, and or recovery, are meet the needs of the individual that's accessing those services, and they're delivered in a manner that is consistent with whatever needs that they have in the right amount as well as in the right setting. So our hope is that anybody who would need mental health and or substance use treatment services and or are actively involved in prevention and or recovery would really be able to access whatever services that they needed within their respective communities.
So what are the trends that we're seeing right now? You know, we hear so much about the opioid epidemic. We hear numbers, but as we stand here, you know, at the end of September 2017, where do things stand in Rhode Island?
Well, we continue to see an enormous number, an enormous amount of both prescription opioids as well as heroin on the streets, and as a result of that, we're seeing, you know, increased numbers of overdose deaths. Now, to add to that is the complication that what we are seeing with regard to fentanyl is a consistent change in the chemical composition, which is resulting in the need for more and more Narcan to be delivered to an individual who has potentially overdosed. So eventually, my fear is that we will come to a place where Narcan, regardless of the amount that is delivered by first responders, won't be able to actually pull somebody out of an overdose. And we'll end up seeing more and more individuals placed in the intensive care units within the hospitals, which is going to cost an enormous amount of money.
And you talk about the changes to the fentanyl composition. I'm assuming, I'm not a pharmacist, but is there no way that Narcan can catch up with that? Is there any potential for any new reaction, way to address folks who might be potentially overdosing?
Well, I know that there is some preliminary research being conducted through the National Institute on Drug Abuse, looking at what other potential medications can be developed to consistently combat the changes that we're seeing out on the street. However, as we know, the development of medication takes a pretty substantial length of time. So for me, let's see if we can get ahead of it. Let's do more prevention work. Is there a way that we can intervene earlier for individuals? And is there a way that, should somebody have experienced an overdose, can we somehow create a better linkage into treatment and then recovery services? So I think that we have to look across the entire spectrum. And we're looking at not only, individuals in their early 20s, young adults and older, but we really need to start focusing some efforts, more efforts, if you will, on the younger and younger population, as well as the older adult, because we're really seeing that kind of use across the continuum.
So let's take a holistic look at the state here and maybe look at what is the state from a governmental apparatus doing well, and where does the state need to be doing better?
Well, I will tell you that the individuals at the Department of Behavioral Health really do have an enormous amount of expertise in terms of looking at the continuum of care. I think that one of the areas that I'm sad to say that we are lacking in is some of the treatment services. Like, for instance, we have very few adolescent treatment programs, residential treatment programs. So that's certainly an area we need to look at. We need to look at how are we delivering services to even younger children. A lot of our children are receiving their services out of state. Mm-hmm. I think the other side of the continuum is we need to look at older adults. I mean, they are a very unique population that require a different approach. And I think that the state has done an incredibly great job at being able to secure federal funding to initiate some new things like screening, brief intervention, and referral to treatment, the SBIRT that's going on. We have a lot of workforce development type of activities that are going on, trying to not only engage people to come into the field of behavioral health, but also to enhance the skills of practicing practitioners, medical professionals, so on and so forth. So when you think about sort of the holistic approach, the more we can access services either through a primary healthcare setting, a federally qualified health center, and or those individuals who might be accessing services directly to the other end, the school systems, the more that we can interact with the community and the people that we serve, I think the better off we're going to be.
So you're clearly aware, hospitals are clearly aware, as you talk about the potential if Narcan isn't going to be effective on individuals, and we see more individuals in primary and emergency care situations needing to be treated, how potentially big of an issue could this be if, again, these folks who aren't able to be helped immediately on the street end up in the emergency rooms?
Well, interestingly enough, there was research that was conducted and just recently published in August of 2017 from Beth Israel Hospital in Boston. They looked at a 5-year span of individuals who have been involved with an overdose, and what they found is that there was a substantial increase in the cost of providing care, and the reason for that is because many more individuals were actually being admitted from emergency room settings into intensive care units.
Okay.
So, depending on what other medical issues or complications may result as, maybe as a result of that overdose, now you're looking at, so how long do they stay in the intensive care unit, and then what level of service do they need upon discharge?
Mm-hmm.
So, the possibility of the cost associated with this could skyrocket if we don't somehow find a way to intervene sooner.
And you talk about intervening, and a lot of times when folks hear about the opioid crisis, they hear of, obviously, folks getting painkillers, getting addicted to painkillers. Now, there was just the article in the New York Times this week talking about this at the national level, insurers restricting pricier, less addictive painkillers. What was your reaction when you saw that? Was it something you knew? Was it something that you hadn't? Talk to us a little bit about that. Is there truth to this?
Well, I think that depending on the type of pain an individual is experiencing, that there are non-narcotic medications out there that could be utilized as first-line defense. And I think that what happened over a period of time, and this now is coming from sort of my medical background, is very early on, there really was a major push to prescribe pain medication from the pharmaceutical company, but there's always been those non-narcotic, non-steroidal, if you will, types of medications available for people who have for whatever reason, are experiencing pain. There are also alternative therapies that we don't necessarily access, such as acupuncture, massage therapy, and physical therapy. And while they're prescribed, they may not be being prescribed as frequently as they could be, and maybe not for as long a duration as they could be. So, for me, I sort of sit on the fence. There are individuals who truly do need the pain medication, and so the key will be to find the balance of how do we prescribe that medication in appropriate amounts to address the pain, while at the other side of the spectrum is we need to be incredibly careful because we know now the dangers of addiction and dependence on pain medication, and so what other alternatives can we examine and utilize?
We talked a little bit before you came on at the national level. We do know that there's the President's Commission on Opioid and Addiction. What are we seeing from the President on the national level? We see so much national news that's focused on so many other issue areas. Do you see this being a level of importance from this current administration?
I do. We did have the Commission on Opioid, looking at the opioid epidemic, and they actually did declare it as an epidemic. And then there's the Cures Act, and from the Cures Act, there was like $438 million that was actually awarded to states across the country. Rhode Island did actually receive some of those funds. They're called the State state treatment response to the opioid crisis, so STR for short,
Mm-hmm.
and they're actually utilizing those funds for a variety of activities to support addressing the opioid epidemic. So, for instance, the prevention coalitions across the state are developing media campaigns targeting adolescents and young adults. We have the lock boxes that are now being created through the Department of Health and made available through the Department of Health. The opioid treatment programs themselves now are looking to develop a program where they would be able to expand psychiatric services for some of our patients, where a psychiatrist or a psychologist would actually go into consultation for patients receiving treatment. So we were incredibly fortunate to receive the money, and I think that it's being utilized in the best way possible at this point in time.
So what can we expect to see from the council? We just got that release that you are the new president, so you're taking the helm, you're taking the reins. You've explained a little bit about what the council does, what the lay of the land is here in the state. Obviously, they're just finishing up the special session for this General Assembly session. Will we see you up at the State House a lot in the spring?
You will see me up at the State House. You know, one of our goals is to work closely with the legislative community so that they have, a better understanding of what it is that we do and the expertise that we actually have within the council. But in addition to that, our providers serve over 20,000 individuals across the state. And so, again, we want to make sure that we're able to provide them the best care possible, and to be able to do that, sometimes it's financial support that we're looking for, and sometimes it's just a matter of, can we revise the language in a bill to provide us with more flexibility to be able to provide a particular type of service. So yes, you will see me up at the State House.
We'll see Sue at the State House. And you mentioned, too, engaging the folks on the council even more to have a more visible presence. What's that going to look like?
Well, our hope is that we're actually going to be conducting some trainings around how do you go out to the community and not only advocate for your patients' needs, but for the needs in general across the spectrum of care. In addition to that, I really am hoping that they will become more actively involved both at the local level and at the state level, either in the development of bills or sitting on committees or those kinds of activities.
I have a feeling we're going to be seeing a lot more of Sue as she takes the helm here as president of the Substance Use and Mental Health Leadership Council here in the state. Just announced, wanted you to come on in, introduce yourself to folks. As I said, I'm sure I'll be talking with Sue more in the coming months, so stay tuned to Go Local. I appreciate your coming in and taking the time.
Thank you so
much. I'll
much.
let you take off. I know you got places to go, so I appreciate your coming in. Take care. That's Dr. Sue Storti, the new head of the Substance Use and Mental Health Leadership Council here in Rhode Island, giving us a little bit of a lay of the land about what she expects during her tenure, what the current conditions are here in the state and nationally, and of course what they're going to be advocating for up at the State House. So as states and the country continues to grapple with this national health epidemic, I'm sure we'll be talking with Sue more in the coming weeks to gain her expertise. So Dr. Storti, thank you for coming in.